executive was going to be a challenge. And my administration went right away into ethics reform, passing several pieces of legislation and signing executive orders. We knew that we could not move ahead without first cleaning up county government. No day is ever as I expected it to be. Every day, though, has been a privilege to make sure that we are working for everyone in St. Louis County. We have a lot to do together. Together we can make a real change. The stay-at-home order has been a success because of the sacrifices of many of our residents in St. Louis County, and I know that they have been difficult. I have received several questions about how the county is going to react to the order by the governor that will begin next week, that will lift some of the restrictions placed on the state of Missouri. The governor has made it clear to me and to other leaders across the state that he understands and recognizes that St. Louis County is different than the rest of the state. And he would expect us to have local restrictions here based on our judgment and our understanding of what's happening right here in St. Louis County. We know that 40% of the coronavirus infections in Missouri are here in St. Louis County. Yesterday we reported 20 more deaths. This is serious and this is real. St. Louis County is unique. St. Louis County has unique demographics and unique circumstances. We still have too many people getting sick and getting admitted to the hospital. We are, however, beginning to see the light at the end of the tunnel. But we can't afford to undo any of the good progress that we have made so far because of our social distancing restrictions and guidelines. I want the economy to be strong again too. I understand our businesses are suffering, our families are suffering, and we have to find a path forward. I expect that we will have a reopening strategy very similar to what happens around the country and around the state. What will be different is the timing of that strategy. We're working closely with our public health department and with our business leaders in our community to determine what that will be, and we should have an announcement either later this week or early next week on what that will look like. As you know, we opened most of our county parks and trails yesterday. That was an important milestone. We do recognize and understand that social distancing and recreation in our parks can coexist. We believe that our residents now have gotten used to the new normal of social distancing, staying 6 feet apart, and not congregating in our parks. Social distancing is working, and it is helping to control the spread of the virus in our community. Opening our parks was the first step, but we have many steps to go, many steps remaining. Also yesterday, the County Council approved the appropriation of $173.5 million to help with the COVID-19 response. This will allow us to get more tests, more PPE, and hire more contact tracers, which is a very important part of the public health response. We want to be able to connect and communicate with anyone who has been exposed to someone who has tested positive for COVID-19 and make sure those people who are exposed have information that they know how to take care of themselves and how to get any help that they need. When we announced that we were hiring 100 contact tracers, we immediately had hundreds of applications, and now we have over 800 applications for these positions. The contact tracers is an important part of this response. The federal grant will also allow us to be reimbursed for some of the expenses we already have related to the COVID-19 response. That includes 1.3 million masks and 700,000 gloves, 34,000 gowns, 84,000 units of hand sanitizer, and 12,750 pairs of safety glasses. You can keep track of all of this through our transparency portal at stlcorona.com. You will be able to follow along for both obligations to spend funds and expenditures that have already been made. I'd like to stop here and take a moment to sign the CARES Act, which was passed yesterday by the St. Louis County Council. This act allows us to spend these funds on COVID-19 related expenses with strict guidelines from the federal government monitored by the United States Inspector General. Any money that is not spent by the end of the year will have to be returned to the federal government under current federal law. Before taking questions, I would like to recognize that St. Louis County Department of Public Health opened testing in North County and South County for members of the general public. We have been providing testing for patients with, for people who are patients in our public health system, and we're now able to open this up to more people. This is another addition to testing, in addition to what is available through the public health systems, through commercial labs, and through our federally qualified health centers. In addition, yesterday, I attended the opening of a testing site in Ferguson. This site is funded by the Ezekiel Elliott Foundation and the Islamic Foundation of Greater St. Louis. More testing sites are great, but we really need more tests. I've instructed the County Health Department to begin the process of purchasing tens of thousands of tests. They opened that bidding process on Monday, and I look forward to having access to those tests, recognizing that there is a national testing shortage, and we are competing aggressively with other local governments and the federal government to purchase testing supplies. I continue to be impressed with the resiliency of the residents of St. Louis County. Every day I come to work to look out for the health and welfare of St. Louis County residents, and I will continue to do so. Our community is working together, and we are seeing progress. Let's keep it up. Questions?
Dr. Bain, last night, I'm sure you're familiar, Mayor Flowers of Eureka put out a letter that he's going to, or intends to, reopen in conjunction with the governor's stay-at-home order ending when our stay-at-home order is still in effect. Your reaction to his plan, and is there a violation that could play out there of some consequence? What happens if Eureka does that?
So I would encourage any business in St. Louis County to get good legal advice about what it means to be operating outside of the laws of St. Louis County. In the past, when businesses were in violation of our order, and we sent them a letter and noticed them of that, they all complied very quickly. And there's a reason for that. I'm sure they got legal advice. There is a lot of law surrounding workers' compensation and exposure at work for employees. And if someone is exposed to COVID-19 at their place of employment, and that place is in violation of a public health order, that would add an added complication to the relationship with their insurance carrier. In addition, an individual who goes to a business and becomes infected with COVID-19, and that business was in violation of a county public health order, that would certainly create a complicated legal environment and a complicated relationship with their insurance carriers. And I believe all businesses understand that, and I would encourage them to get good legal advice as to what it means to be in violation of a county health order, and that authority of the county health order is granted through the state legislature and through state laws. I understand the frustration of all of our municipal leaders. I've been talking to them, and I'm working with them, and I want to get our economy and our remaining businesses open as soon as possible. We have to recognize that St. Louis County is much different than the rest of the state. There are areas that will border areas that are open. There are always those transition areas at state borders, at state lines, and at county lines. And it will be especially frustrating for a city like Eureka that is in both Jefferson County and St. Louis County. And we'll continue to work with all of our municipal leaders to help them through this very difficult time. And one of the things that I did ask our elected officials, our council members, our elected leaders, is to help us identify ways that we can help with the St. Louis County CARES Act. We intend to receive ideas, information, and input, not just from our elected council members, our elected mayors, our community leaders, our nonprofits who are already very active in humanitarian relief, our workforce development agencies. We're all going to be working together very quickly to make sure that this funding goes to work in our community in a way that helps everyone.
Will the county take action against Eureka if they move forward?
We'll certainly look at all of our legal options, sure. But it's been my experience that people who own businesses and run businesses are very astute, get good legal advice, and understand the environment that they're in. I would just recognize that it's a very frustrating situation for all the mayors in St. Louis County who depend on sales tax revenue to balance their budgets, just like St. Louis County depends on sales tax revenue to balance our budget, and it's going to be a very difficult time moving forward. But we have to do this right. We only have one chance to get this right, and by extending our own stay-at-home orders here for a few extra weeks, recognizing that St. Louis County is much different than the rest of the state, by doing that, then we dramatically lower the risk of having to do this again. And we know the infections from COVID-19 will increase when we relax social distancing regulations. We know that. It's happened across the world. It's happened across the country. It's important that those infections are produced at a rate that we can manage them thoughtfully, that we don't overwhelm our hospitals, that our patients our residents will still get the same standard of care when they go to a hospital, because the hospital has resources, the hospital has ICU beds, the hospital has ventilators, and they're not overwhelmed. So we will always be making this tough decision of what level of social distancing do we have to control the rapid spread of the virus in our community. What helps us control the spread of the virus in our community is an adequate testing environment, aggressive contact tracing, and everyone following all of the social distancing guidelines that individuals are obligated to do and are responsible for themselves. It's a very complicated balance between lives and livelihoods that will continue for some time until we have a vaccine. And we're going to work with everyone to try and make sure that we only go through these closures and limitations and social distancing and business activity, that we only do this once. We do not want to do it again. But we have to recognize that St. Louis County is much different than the rest of the state. The presence of the virus in our community is much more like Illinois than the rest of Missouri.
You spoke earlier about a strategy for reopening, and more information on that coming out maybe later this week. In our conversations with Mayor Flower, one of the frustrations there is that he's looking, like everybody else is, for some kind of timeline. Mm-hmm. Especially since we've now hit what appears to be a plateau.
Yeah, we believe that we are probably there. We're watching that now, but we believe we are probably at plateau. The numbers ticked up a little bit yesterday. Mm-hmm. It's very difficult to make that decision from 2 or 3 data points, but we believe that we're getting there, and that's the direction we've gotten from Dr. Garza. We expect to and hopefully start trending down in the next few days.
Could you speak to you say you hope to come out with a reopening strategy later this week, and do we have any kind of a further timeline?
No, I think we need to see what that strategy looks like, and we can't create that timeline until we're sure and confident that the cases are going down, and we're sure and confident that we have access to tests in our community, because without access to tests, that is an extraordinary barrier to being able to relax social distancing, because we know that the spread of the virus in our community will move very quickly and will increase very quickly, and we have to have an adequate testing environment to determine who has been exposed, who tests positive, and make sure they are quarantined, make sure we track down their close contacts, and the people that aren't COVID positive can continue with their day and their activities and their work.
And you say you're hoping to come out with more information about the beginnings of a reopening strategy later this week?
Later this week or early next week. As far as a timeline, I'm not sure if we'll have a timeline by next week, but we'll certainly have some strategies and guidances for businesses. But we understand that mid-May is right around the corner, and we're aware that we would want our businesses to have at least a week's notice so they can prepare for any change in the stay-at-home orders.
You mentioned earlier putting out bids for equipment. What kind of time frame will that take?
Well, the bidding process is through our procurement, through our emergency operations. I'm not really close to that. We're able to get bids in an emergency situation in a few days. The normal procurement process would take months, and we don't have that luxury in this setting. So we want to make sure that our ability to purchase supplies is competitive and that it's a good value. And so we generally have an expedited RFP or bidding process that only lasts a few days instead of a few weeks.
Does the optics of that, of having a bid, though, kind of go against what you said in the past by not including the council, even if this is an emergency, we have to move quickly? Does the bidding process kind of say, well, it's not that quick then?
Now, bidding process in an emergency is always shortened. We have the ability to buy into a contract that's already been competitively bid by another government entity. So if another government entity has already gone through a competitive bid and has a contract that was bid competitively, then we have the ability to opt into that contract. Generally, we try to get bids because it's a better value, and we try to have the bid process shortened to a few days so we can quickly get to a decision and quickly get goods and services and needed things into our community.
A couple questions with testing. Do you know how soon it will be for more testing to be in the county? And I know that's probably based upon getting more of the supplies. But with that, is there a timeline with the criteria to be relaxed for not such specific symptoms or whatever? How's that going to go?
I would like to see that as soon as possible. That's an important part of our reopening strategy, and it really depends on the number of tests that we have in our community. It completely depends. If anyone has a limited supply, then the guidelines from our public health officials will always be to direct that supply to the greatest area of need: people with chronic health conditions, people in nursing homes and other senior living facilities, first responders, people who are sick and in a hospital, doctors and nurses who are working in hospitals, and those have been our priorities to date. But I would expect that sometime soon we'll be able to relax those criteria. I read today in the Business Journal that Centene had purchased some tests and we're distributing them nationally to federally qualified health centers. Our FQHCs are our partners in this testing strategy, and we would want them to have the supplies that they need as well.
Are the testing sites being fully utilized? Like, are all the tests being used from those testing sites like we were yesterday? I know there's not a big line with the way they're kind of just trying to stagger people to come in and out, but were all the tests used? And if not, does that mean that either people aren't as concerned with it or that those tests could be kind of distributed to less?
Yeah, so management of the supply chain is extraordinarily complicated, and I'm not down in the weeds of that decision, but that's one of the things that we do watch, how are tests being consumed. That's why it's so important to call and get an appointment, and important to be staggered and not have people waiting in line close to each other. But it's important to call and get an appointment, and the people who make those appointments, they track the symptoms of people who are calling, and they track people who are presumed positive but don't necessarily meet the criteria for access to a test. But they track those people who are presumed positive are still entered into the system. They're still managed by public health officials. They're still managed by a doctor, even if they don't have a positive test. If they have symptoms, then we begin to get involved in managing them and checking on them.
One of the other issues that you spoke about, again, alluded to earlier, but I'd like you to elaborate on, is the deaths reported in St. Louis County yesterday. It was a significant jump. Obviously, we know there could have been some delays in notification in the health department, but whatever the case, could you speak to just that issue of the deaths in the county increasing by that amount and what that tells us about where we're at in the county? It's got to be troubling no matter what situation.
So the deaths, the only thing we know about the deaths is they happened sometime yesterday or before yesterday. We just don't know how many days they represented, but 20 deaths is a significant number, whether it's 3 days or 5 days or 7 days. But the process of COVID-19 infection is people get exposed. Some people have symptoms. Some people get really sick. Some of those people get in the hospital. Some of those people go into the ICU. Some of those people end up on a ventilator, and that all takes time. That's a continuum of a few days to a few weeks. And then some people don't survive the process with COVID-19. But that's the end stage of this continuum of exposure. And that's why we have to be very careful with relaxing our stay-at-home orders, because as soon as we relax those and the virus begins to spread in the community, as we expect it to, then we want to make sure that it moves at a pace that we can manage, because it'll be 2 weeks or 3 weeks before we see the surge in the hospitals after we relax our stay-at-home orders. So we don't see the impact of that decision in our hospitals for several weeks. So that's why we watch and we make sure that things are coming in the right direction before we make a change in our stay-at-home orders. But we do have to have an enormous amount of respect for how different St. Louis County is than the rest of the state. We have many more COVID-19 infections here We have many more people hospitalized, and we are not in the same position as the rest of Missouri. The governor recognized that. He said it several times. He said it in his order. He said it in his frequently asked questions. He's told me that personally on a couple of occasions. He's told our staff that. He understands that St. Louis is different, and he is his order has made a statement that local leaders need to make a determination at the local level. Any questions? Doug, anything?
Yep. Anybody else?
Okay. Thanks, everyone. Good morning, everyone, and I'll say what I've said before. I want to thank everyone in St. Louis County for their patience through these very trying times. The sacrifices that everyone has made so far has had a big impact on the spread of this virus in our community. As we continue to work on our plans for reopening the economy, we have to be patient with those who have a different opinion. This is a novel coronavirus. That means we haven't seen it before. The doctors and scholars and scientists are still learning about this virus every day, and we're still trying to figure out the best path forward. As a medical doctor, I'm certainly familiar with viruses. I know the COVID-19 virus is highly contagious, and it affects individuals differently. Some people don't have any symptoms at all, and some people become very, very sick. We know that the precautions that we have to take in order to prevent the spread of this virus are very difficult, but we have to continue taking precautions. We have to continue this social distancing until a vaccine is available. And we know that a vaccine will not be available anytime soon. But these social distancing restrictions that we have taken have made a real difference. And now it's time to talk about what it would look like ending some of the restrictions and getting our businesses open again. We know that the economy has taken a devastating hit. Livelihoods have been destroyed, and elected officials like myself have been put in the position of having to choose between lives and livelihoods. We understand what that means. But the decisions we've made in this pandemic, we believe, have saved lives. We have seen this become a partisan issue, but as someone once said, politics is in everything that we do. During a pandemic, there are almost as many data sets as there are opinions. We need to follow the models of our top healthcare officials. I speak with Dr. Garza on a regular basis, who leads the St. Louis Metropolitan Pandemic Task Force, and you all have seen the information that he presents on a daily basis. I'm in multiple conversations a day with our public health department and the information they are processing as this region responds to the pandemic. We expect Governor Parson to relax the stay-at-home orders for the state next week, and we expect announcements later today on what that would look like. He has the context of the entire state in mind when he makes his decisions. I don't believe that St. Louis County is ready to relax our orders. St. Louis County is much different than the rest of the state. We have almost 40% of the diagnosis of COVID-19 of the whole state of Missouri. But even though it's too early to lift our stay-at-home orders, it's not too early to talk about what that might look like. And we will begin with our parks. Tomorrow, I will be announcing a plan to reopen, with some restrictions, our county parks. We will allow some of our residents to enjoy some of our best amenities, and our stir-crazy kids will have some options to release some of their energy. We can certainly take advantage of the spring weather. Closing our parks proved necessary to help stem the spread of the coronavirus in our community. Reopening them with some restrictions, we believe, is the right thing to do. Recently, I announced that retired business leader Cindy Brinkley was joining our team as a lead advisor on the county CARES response. We know this crisis has three components to it. We have the public health crisis, we have the humanitarian crisis, and the economic crisis. Cindy will oversee the economic recovery. I've asked Deb Patterson to oversee the humanitarian relief. Deb is a former president of the Monsanto Fund, which on a yearly basis delivered tens of millions of dollars to the St. Louis region to support community efforts and community challenges. Deb is also the former president of the Red Cross of the Eastern District of Missouri. Deb will be volunteering her time in this initiative. Joining Cindy will be Dr. Paul Hensey, who is working part-time in our health department. Paul is the former chief medical officer for Mercy Hospital here in St. Louis. Also joining us will be Kathy Reamer. Kathy is a former chief compliance officer for Enterprise Holdings. Kathy will be responsible for the compliance part of our County CARES Act. Kathy will also be a volunteer. In dealing with this pandemic, it's important to bring the top expertise and top individuals into our administration to help with our county response. We've also heard a lot about contact tracing over the past few months. This is an important part of stopping the spread of the virus in our community. Contact tracing is something we've been working on for some time. We currently had 70 individuals working in our health department. Last Friday, when I announced that we would be hiring 100 more individuals, we had, as of today, over 200 applications. Our health department now is going through those applications and identifying individuals that would be able to help us. We also have new technology to help us with contact tracing, technology that's been built by our IT department. It looks very similar to the technology that we have for tracking opioid overdoses in our community, which we started doing a few months ago. This new technology will help us a great deal. Historically, for contact tracing, this has been a pencil and paper process where paper files have been passed back and forth between individuals. But having this technology now electronically will allow people to work from home and will also limit staff-to-staff contact during this response. Contact tracing is a very important part of the public health response. It was part of the response in the history of our country to the smallpox epidemic, and it was an important part in containing the spread of smallpox until the vaccine was available. It's time-consuming, but it's necessary. In fact, contact tracing is much like the work of a police detective or an investigative reporter putting together the pieces of a puzzle. When someone's in close contact with a person who's tested positive for COVID-19, it's important to find them, get them the information they need to keep them safe so they can get treatment, then they can know the symptoms, and they can have access to support while they're waiting to see whether or not they may also contact COVID-19. As our daily numbers show, as you can follow through stlcorona.com, we continue to have more cases every day. We continue to have people in our community who are dying from COVID-19, and we cannot lose sight of that when we're talking about peaks and plateaus and recovery. This will forever be a part of who we are, including our response. And I'd be glad to answer any questions.
Can you give people a rough idea of your timeline as it relates to parks? Are we looking at mid-May? Are we looking at sooner than that? I think a lot of people are eager.
No, it'll be sooner than that, and we'll make an announcement in the morning with all the details about the restrictions and what that will look like. We do believe that we can do this safely if we adjust the behavior of people in the park, provide them with instructions and support, and can prevent crowding. We all know that a crowded park will lead to a closed park. We've seen that across the country, and we've seen that here in our community. But we think we have a plan moving forward. Yes?
I know we've heard a lot from the council and from other people about the spending of federal funding from the CARES Act. And so what's your reaction to the people that are against you having the power to spend the $173 million from the federal funds without the oversight of the council?
Well, the council will always be involved in our decisions. When you're in an emergency, it's not responsible to come back to the council on a weekly basis or an emergency basis to be able to buy more tests, if those tests become available, to be able to buy more PPE, to be able to respond to a humanitarian crisis, to be able to move quickly. This is just like any other grant. We've appropriated $270 million worth of grants over the past 5 years. They've all been appropriated by the council. They've all been monitored by the granting agency for compliance. The monitoring of this grant will be by the Office of the U.S. Inspector General to make sure that it's spent appropriately and within the guidelines. We will have something that's never been seen before with a grant. We have an accountability portal in real time that will show us where the money's spent. This really is a decision by the council. Unfortunately, it's become partisan, with the council divided on partisan lines on the best way forward. But I hope that even though there are differences on this one opinion, that we can, or this one bill, that we can continue to move forward and take care of the needs of people in St. Louis County. I've always looked to the council for advice and direction on everything that we've done in my administration, even much more than anyone has done in the past, and I will continue to do that, even if we disagree on this one issue or others moving forward.
Can you speak a little bit to, this is something else a lot of people have been talking about, of course, the information of the tipsters that was released through public records of people who were reporting some of the stay-at-home order violations. Can you touch on that, but can you also tell us how that differs from tipsters in other capacities who are reporting different kinds of violations and crimes, and why their names wouldn't necessarily be released?
So we follow the advice of the Attorney General as far as the response to the Sunshine Act. The previous administration was sued by the Attorney General. My administration settled that lawsuit, and we now take guidance from them, and they're the ones that helped give us advice on how to respond to this. We recognize that information as to whether or not it would be a public record would be controversial, and we asked the Attorney General for advice before we set up that system to accept complaints, and that's why online it advises individuals that unfortunately this is a public record and we have no control over that. What people do with that information, when they have that, reflects more on the individuals who have that information than anything else. I do not and would not expect anyone to retaliate against someone who made a complaint or identified a concern in good faith. And I think there are many rights for people who are retaliated against, but it doesn't stop bad behavior on social media, which unfortunately we see a lot of, and in a hyper-partisan election environment, and unfortunately this issue about whether or not to follow safety orders, whether or not to close difficult choices between lives and livelihoods, is an extraordinarily partisan issue that starts at the top of the leadership of our country and filters right down into local government.
So there'd be no plans then to along those same lines, release the names of a 911 caller or a tipster about a shooting or something to that effect?
Yes, so information related to public health orders and information related to stuff within the police department, those are treated differently. And again, I follow the advice of the attorneys and the Attorney General's office. That's not something that I can dive deeply into. I just ask the attorneys what the right path forward is. I ask the highest law enforcement officer in the state what the right path forward is, and I follow those. I think this is more a reflection of human behavior and a very complex time in our history of our country and the history of our region, and a hyper-partisan environment that we live in right now while we're struggling through a difficult time. This is becoming more polarized, this balance between lives and the economy, and we're seeing some very unfortunate behavior on all sides, but I do have to follow the law.
Multiple times, a lot of the reopening that has to do with testing and getting testing done, getting people tested. Where does the county stand on how many tests we have, how many tests we have ordered, getting all that testing kits and equipment that we need?
We are competing with the rest of the country and the federal government to buy tests. We have the same challenges as everyone in the country. We know that New York has been devastated, and they were only able to get a few thousand tests to test their population for the presence of COVID-19, and we will continue to compete. We offered vendor information and opened up bidding on Friday to purchase as many tests as we could. We didn't put a limit on that for anyone to bid on how many tests they could supply us, and we just asked them to tell us what that would cost, and we'll compare those. We will work cooperatively with other jurisdictions in our region to purchase tests. Every day a new entity comes onto the market to offer tests, but they generally only have a handful because they also struggle to purchase tests in our country when there aren't enough tests being made for the people who need them. Our health systems have access to some tests. They share them with us, but as it stands right now, we don't have a robust enough testing environment for everyone who is symptomatic to get tests, and that's an important part of our reopening strategy. We know that if we reopen before we have a good testing environment, then we risk not being able to test, track, isolate, and contain the spread of this virus in our community, and that would put us at high risk for a second wave even sooner than November. So it's very important that we have the virus infection rate in our county down dramatically from where it is now, and then that we have the ability to test. And we are all extraordinarily frustrated with our inability to find tests that we need in our country. And our community is competing very aggressively for those, just like everyone else.
Is that big multi-million-dollar order that we've been hearing about the last couple of weeks still contingent upon maybe what happens tomorrow night? I know you said if that vote got the green light, that would really make it a lot easier to make those.
Yeah,
votes.
it's if you want a slow response to an emergency, tie up the funding. Everybody knows that's how it works, and we don't need to be spending our time going back to the council every week or having emergency meetings because we found something that we need for our community. What we do need to do is have a good working relationship with the council on their ideas to help support our community moving forward. I've always looked to them, both Republicans and Democrats, for their ideas and for their direction, and that was my leadership style when I was chair of the county council for years. Unfortunately, this is an election year, and things become partisan in an election year. And unfortunately, we're in a hyper-partisan environment because of the division in our community on how to approach this epidemic. And the balance between lives and livelihoods is very deeply divided, people are choosing sides. We have to try and move through that. We have to respect people who have different positions than we do on an individual bill or an individual issue. We need to look past the rhetoric that sometimes accompanies those positions, and we have to look behind that and listen to what they have to say, because sometimes behind that rhetoric there's still good ideas, and we have to find those ideas and work and move forward with them together. And that's what our residents will expect. They will expect us to find a way forward and work together, and I'll continue to try and do that.
Hey Sam, I wanted to clarify something really quickly. Kathy is from Energizer, not Enterprise.
Oh, did I say Enterprise?
That may have been in your remarks as a mistake, but
Yeah.
we just wanted to make sure. everyone knew
Energizer,
that.
that's right, Energizer Holdings. That is in my remarks if I said Enterprise. They are very different. Both fine institutions. Any other questions? Okay, thank you.